had an individual that just turned 50 years old that qualified in our EMR set of rules for colon cancer screening. Not really, the gentleman wasn't really that excited about doing that test, and was convinced to take it home, and he agreed to bring in his fit test, and it turns out that I called him back to let him know that that in fact was a positive test that needed following up within a short period of time for colonoscopy. He has gone on to having surgery and treatment for cancer, and he was completely asymptomatic, which means he had no signs of any problems in his health. He'd been completely healthy up to that point. He's also a father of 6 children, and this never occurred to him that it would be anything but a perfectly normal test. He's also contacted as a result his siblings. He's from a large family himself, and a sister of his has gone on to also have early signs and positive testing for colon cancer as well. It's really dawned on him that that screening is important, and that everybody should be doing screening.
One success story, just because I saw her today, this is a lady who was, her rule kept coming up to have a mammogram done, and she refused. So, and part of what makes it good is, not good, but you get a second chance, because if the medical office assistant asks her whether she wants to have a certain procedure or a screening done, in this case it was a mammogram, she says no, there's a note there that she refused, and then I have a second chance. Not that doctors are the be-all and end-all, but it gives you they have a time to reflect on that, and then when I ask, maybe they'll change their mind. So this is what happened a couple times with this particular lady. She did have a mammogram, turned out to be a cancer, you know, and has now gone on for treatment and whatever. But if those mechanisms weren't in place, she was not a type of person to just bring it up, oh, I think I'm due for my mammogram. So it was because of our system that was picked up, and, you know, potentially life-saving for sure.